It all starts with communication, and I think as you interview plastic surgeons, it's super, super important that you feel that the surgeon is actually hearing what it is you want and listening to what you want. I somewhat regret the fact that the very obvious plastic surgery is what we see, and the subtle, what I consider elegant, idealized in my mind, plastic surgery is not so noticeable as a female, because I find that an awful lot of the facial cosmetic surgeons tend to be male. And it's interesting, it's almost like, sometimes I wonder if it's a Pygmalion response that women go to males to have this done, and maybe they need that affirmation. I'm honestly not sure. There was an old slogan in the Clairol ads that went, "Only your hairdressers should know for sure." And how does that relate to plastic surgery? And it really raises the question as to whether plastic surgery in its ideal form is something which screams from across the auditorium or stage, or whether it is more subtle. And in fact, the work of the plastic surgeon can't be seen, but the patient looks fantastic. I can't lie. There are too many instances, and watching television, particularly reality television, where I find myself staring at the screen at blatantly what I call extreme plastic surgery, where the plastic surgery is written all over a patient's face or their body, and their body is exaggerated and totally out of balance, and missing the harmony that I would ideally like to see. It's pretty clear, I think our work should enhance, but I do not feel that we should be putting faces out of harmony, and I do not feel that we should be totally redefining what an aesthetic face is. You know, over-exaggerated lips, always the easy one that comes to mind. The second that comes to mind is where patients have these super tight necks and their heads sit there like one of those bobble dolls. The worst thing that can happen in a plastic surgery office, both for the patient and the doctor, is regret. And regret is avoided if everybody is clear in the communication. First of all, I start with a conversation about some labels for breasts, and I actually use them on a pretty regular basis. And I talk about ballerina breasts, and I talk about sporty breasts, and I talk about sexy breasts, and I talk about voluptuous breasts, and I talk about hooter breasts. Patients in the trauma of having a cancer diagnosis need to take a breath, need to do their research, need to ask questions. One thing that comes as a surprise to patients, again because implants are so ubiquitous in our society, that they are under the wrong assumption that this is a simple procedure. They all want a quick fix, they all want a magic wand. I think as plastic surgeons, and certainly in the media of the plastic surgery industry, we tend to overpromise. But here's the kicker. Some patients, every patient is an individual, and every individual who walks into your office has many factors going on with their face and how they've led their life and their genetics. You can't paint every patient with the same brush.